This is the bony vertebrae, and these are the discs. Inside the spinal canal lies the neural structures. You find the spinal cord, which ends at the level of T12L1. The conus medullaris, it is the lower end of the spinal cord. And the coda equina, which begins at the level of L1, and it contains a lot of nerve roots. Low back pain is caused by different conditions of the lumbar spine, including disc herniation. The lumbar spine has 5 lumbar vertebrae from L1 to L5. As you can see, these are the 5 vertebrae and they are numbered. These vertebrae are attached to the sacrum at the lower end of the spine. When we say the lumbosacral spine, it is the junction between the lumbar spine and the sacrum, between L5 and the sacrum, which is the tailbone. The discs between the vertebrae are round, cushioning pads which absorbs the shock and resist compression. The normal disc is composed of 2 layers. The inner layer is soft gelatinous tissue called the nucleus bulbosus, and the outer layer called the annulus fibrosus, which is strong and thick. Behind the disc lies the spinal nerve root and the coda equina. A lumbar or lumbosacral disc herniation could affect the nerve roots. In the majority of cases of disc herniation, the L4, L5, and L5S1 disc levels are involved. Typical herniation of L4, L5 disc will affect the L5 nerve root. Typical herniation of L5S1 disc will affect the S1 nerve root. What are the types of disc herniation? Patient may have protrusion or bulge, a bulging disc with intact annular and posterior longitudinal ligament fibers. So that's a small disc